Hey man, just reporting this x-ray and something just doesn't look right to me, but I can't quite put my finger on it. Can you have a quick look? I sent you the link.
Looks good.
Cool, thanks. No acute fractures identified. Image joints demonstrate normal alignment. Impression, normal examination. End report. Hey guys, now that I've shown you all exactly how not to be a radiologist, I'll move on to the talk that I was actually supposed to give today. For those of you who haven't met me yet, my name is Saji and I'm one of the radiology registrars here at RBWH. In giving this talk, I'll try and give you guys some insight about all the different things radiologists do. I'll walk you through the training program, as well as talk about some of the various career options you have post-training. And for those of you who are already keen on radiology as a specialty, I'll drop a few pointers at the end on what you can do really early on to start making yourself into a radiology trainee candidate. The first thing I want to say is that radiology as a specialty is really expanding quite quickly. This is in part due to technological advance and increased availability, but also due to a growing realization in the medical field in general that imaging tests are a very accurate and efficient means of making diagnoses. As you're all probably aware, reporting on imaging studies is the crux of diagnostic radiology, and there's huge variety in that, ranging from chest x-rays to trauma pan scans to oncology staging. In addition to this, radiologists have also become major players in MDT meetings, where their role is to run through imaging in real time with treating specialists to help find answers in some of the more complex cases. Outside of reporting, we also do a whole host of image-guided procedures, like steroid injections, biopsies, drain insertions, lines, as well as fluoroscopy. Now, I have zero authority to talk about interventional radiology. That's a whole separate post-trainee fellowship. But the people who pull clots out of the brain when a patient has a stroke and perform embolizations when a patient is bleeding internally, they're your interventional radiologists. Another thing I will add is that nuclear medicine, which is traditionally part of the College of Physicians, is becoming more and more integrated with radiology as their newer examinations utilize cross-sectional imaging. You can actually qualify in nukes by doing a post-radiology fellowship. One of the best things about radiology is that there's a huge variety of job options, and you'll more or less be able to find something that satisfies your career interests whilst also matching up with the lifestyle that you want. For example, if you want to make a name for yourself as the local expert in one specific area and lead MDT meetings in a tertiary hospital, you can do that. If you like working in emergency and want to be an expert in trauma, you can do that. If you're more of a hands-on person and you want to do procedures all day, you can do that as well. If subspecializing in a big center isn't your thing, there are radiology clinics pretty much everywhere where you can work with patients and their doctors in a smaller community. And lastly, one interesting job prospect I'll share with you has to do with the emergence of teleradiology. If you have any desire to travel for a bit whilst working, that's hoping pandemic is a distant memory by the time you guys finish training, there are companies that will basically employ Australian radiologists to live overseas, I'm talking places like New York and London, to take advantage of the time difference to report after-hour studies done in Australia. My favourite place to work would have to be the emergency department. You get to play the role of detective there, matching up what the emergency physicians have found clinically in a patient to what you can see on their imaging. You get to be a valued member of the team, and it's often a lot of fun going through the cases with the ED docs. They're always quite impressed with how many things you can spot going through a scan really quickly. I assume this is going to be a common theme in this video series. Every college sets really hard exams, and radiology is no exception. Because our scope is so wide, literally the whole body, and the depth of knowledge required about each body system is very close to that of each medical and surgical subspecialty, our exams are definitely up there as one of the hardest. So I'll use that as a segue into talking about our exams. We have two big sets of exams through training. You sit the Part 1 series right at the beginning, and that involves a very high-level anatomy exam as well as a basic imaging physics exam. Then there's the Part 2 series, which you do in your senior years, and that comprises 3 written exams, including pathology, and then a viva for each body system, as well as general pathology. I will note that that structure will probably change a little bit in the next few years, but I have no doubt that there will always be lots and lots of exams in radiology. Another thing which you have to appreciate is the sheer amount of time that you'll be committing to radiology training. You need to do a minimum of 2 years clinical work before you can start as a registrar, and that can be resident rotations or a PHO or registrar job in another specialty. I guess it goes without saying that you should try to do something that is relevant, either by means of exposure to imaging or by clinical experience. Radiology training itself is 5 years, and you can work as a diagnostic radiologist after that, but many people go on to do a further fellowship in a subspecialty that they develop an interest in during training. I will say that in a large centre like RBWH, many of the radiologists have done fellowships or even multiple fellowships in different subspecialties. And if you want to be an interventional radiologist or dual train for nuclear medicine, that would involve doing at least a 2-year post-trainee fellowship. When you apply for radiology, you apply to the Queensland Training Network, and from there, you can preference one of the hubs to be your main training sites. In the last year, there were 200-something applicants over 2 intakes, and by that I mean there's an early intake, which goes with the normal medical calendar, as well as a mid-year intake. I've put the dates for applications and interviews up there for you on the slides. Now, just under a quarter of those who applied last year were interviewed, and about half of the candidates interviewed were given registrar positions. Breaking down the maths, that's less than 1 in 8 serious applicants being accepted, so it is very competitive. There are a lot of things you can do as a resident to work towards applying for a training position. I know live courses and big conferences are kind of out this year, but being in the tech-savvy profession, there's a ton of online content you can look at. One really useful online course that I'd recommend for residents is Radiopedia's Emergency Radiology course. It's actually made from content recorded from a live conference previously, so it's really well presented, and the stuff they cover is relevant pretty much to anyone working as a doctor. 2 other online courses to look at if you're really committed and wanting to gear yourself up for a registrar job is this Medical Imaging Anatomy course, again by Radiopedia, as well as this Medical Imaging Physics course, and that's run by the University of Westmead. These are both good intro courses, and they're also very relevant for the Part 1 exam if you do end up getting a registrar position. Another really great thing to do, and this is obviously in a post-pandemic world, is to grab a group of friends and attend a RANSCA annual scientific meeting. You'll get to see some of the new developments in the profession, and there are plenty of sessions targeted to a more junior level. Doing a research project is also really good in terms of learning something specific to radiology, and the ASM is a great chance to submit a poster or even do a talk. Last but not least, once you're serious about applying for radiology and you've built a bit of a CV, get in touch with our Radiology Network coordinator Justine and organise a candidate meeting with the directors of training. Justine can answer any specific questions you have about training or the application process, and the TOTs can give you feedback on how you're going and what you can do further if you want to become a radiology trainee. And that's a wrap, guys. Hopefully that was useful. Thank you for watching, and hopefully we see some of you in radiology in a few years' time.